Treatments. What are treatments? Treatments are the different specialized techniques that healthcare providers use in hopes of improving one's well-being. Through this, there are many different types of treatments that are used in many divergent practices and for many different or unique types of patients. Established by the APA, treatments must follow a set of ethical guidelines to ensure the safety of patients. This set of rules and restrictions include avoiding harm, fidelity, integrity, and respect of people's rights and dignity. Types of therapies. Psychodynamic therapy. This therapy helps patients tap into their unconscious mind to help them find the root cause to their problems. Cognitive therapy. Cognitive therapies involve helping patients rebuild their way of thinking to help them. They also help patients shift their focus on something more important and beneficial to them. Behavior therapy. Behavior therapists will help their patients shift their maladaptive way of thinking and replace it with more adaptive thoughts and behaviors. Cognitive behavioral therapy. Patients will work through their emotions and reactions to help reshape them into a more appropriate way of working through their emotions. Humanistic therapy. Therapists will work with the patients to help them reach their fullest potential and strive towards growth. Aspects of therapy. Psychodynamic therapy. Aspects include the following: free association, which allows the patient to freely express their thoughts no matter how embarrassing or questionable. This is a fundamental rule of psychoanalysis that helps in moving from repressed thoughts to awareness. Dream analysis, involving interpretation of dreams as they're seen as expressions of unconscious wishes and desires. Resistance, avoiding painful topics, a natural defense mechanism. Transference, the reaction between the patient and the analyst intensifies as the analysis mirrors the patient's reactions to other significant people. Insight, the process of becoming aware of unconscious conflicts, often interpreted by the therapist. Working through is when the patient works on gaining a new behavior or attitude to cope with their stress, often after insight takes place. In addition to psychodynamic therapy, cognitive therapies focus on cognitive reconstructing against dysfunctional thinking. Key concept being the cognitive triad, how depressed individuals often have negative thoughts about themselves, the world, and the future. Behavior therapies. Behaviors therapies incorporate exposure therapies, including systematic desensitization, which are used to treat anxiety through a structured method that incorporates classical and operant conditioning principles. This approach to therapy helps individuals address their mental health challenges through understanding and making modifications to thoughts, emotional responses, and behaviors. Behavior therapy also includes aversion therapy, biofeedback, and token economies. Aversion therapy, designed to make a patient give up on undesirable habit by causing them to associate it with an unpleasant effect. Token economies are used for a similar treatment to teach how to discriminate among stimuli, reinforcing desirable behaviors and punishing unwanted behaviors, trading items and privileges that are desired. Biofeedback, usually used in treatment of anxiety and depression. Psychological activity is recorded using instruments that works on the sympathetic and parasympathetic nervous system. Cognitive behavior therapy. When it comes to cognitive behavior therapy, there are rational emotion therapy and dialectical behavior therapy. Replaces irrational beliefs with rational ones to manage anxiety and depression, focusing on three musts and Beck's cognitive triad. The three musts. You must have sincere love and approval almost all of the time from your significant others. You must prove yourself to be adequate, competent, and talented to be important. And you have to view life as awful, terrible, horrible, or catastrophic when things don't go your way. DBT helps manage emotions and behaviors through mindfulness, distress tolerance, and interpersonal skills, promoting a more fulfilling life. Humanistic therapy. Person centered therapy focuses on a warm, therapist centered relationship. Key concepts include clients versus patient, client seeks help, patient needs fixing, unconditional positive regard, acceptance regardless of behaviors, empathy, understanding others' perspectives, active listening, grasping content and feeling, reflection, summarizing the client's message, and congruence, being genuine in the relationship. Therapeutic groups and group therapy utilize group dynamics for healing. Family therapy treats the family as a unit, and support groups, mutual help groups for shared experiences. Medical treatments. Medical treatments alter disordered behavior by directly altering underlying activity of the brain. Anti-anxiety drugs. These drugs are used to reduce the symptoms of anxiety. Psychological dependence could cause sleeping disorders like insomnia and also muscle tension. Antidepressant drugs are used to reduce or treat depression altogether in depressed patients. Antipsychotic drugs affect the neurotransmitter dopamine. This is used to treat psychotic behaviors and symptoms. Surgical and invasive treatments. Surgical treatments involve operations performed by surgeons to remove, repair, or replace tissues, in this case, often the brain. Invasive treatments require instruments to be inserted into the body, but not always surgically. Studies. Meta-analytic studies indicates psychotherapy studies are effective, shows that to deliver therapy successfully, there must be a therapeutic alliance between the caregiver and patient. Institutionalization and deinstitutionalization. This shows how many mentally ill patients were institutionalized in 1955 versus 1980. In 1955, 60% of mentally ill patients were in institutions. In 1980, it was 15%. Deinstitutionalization was due to psychoactive drugs, psychotherapies, community centers and outreach centers, and better follow-up care. Deinstitutionalization often occurs due to use of psychoactive drugs, psychotherapies, follow-up care, and community outlook centers.